Hi, my name is Dr. Anush Sarda from Intima Heart Care, Nagpur. First of all, my sincere thanks to a team of Dr. Sharath Reddy sir and the team of Medicover Hospital, Hyderabad. They have arranged a fantastic program on CTO, and they have nicely named this program as a decoding of CTO. We have learned the basics of the CTO during this 1 or 2 days session, and it's really fantastic to have basics of CTO and the basics of technique. What I have learned, particularly the ambiguous the CTO by means of iOS. That is one of the fantastic session for me to learn. And my all best wishes to Dr. Sharath Reddy sir and the team for such future endeavors. Thank you.
I'm Dr. Rajendra Patil, intervention cardiologist from Jupiter Hospital, Pune. This workshop was very excellent because what I feel it was to the point. It was not only about doing the cases, but the proper management, the learning of the angiography, planning on the angiography, and what we are going to do in the intervention. Every step should be a precursor for the another step, next step, which needs to be done, and precisely avoiding the further complications and check about the multiple approaches what we can go for the CTO, and definitely very excellent learning here. Thank you.
Hi, I'm Dr. Mateen Parker, intervention cardiologist from Parker Hospital, Ratnagiri. This was my first time coming to Medicover. I would like to thank Reddy sir and entire team for conducting such programs. It was absolutely a great program, decoding the CTO. Best part was for the young cardiologists, it was step-by-step approach towards the CTO lesion and how to analyze every CTO. I was guided and how to approach toward it. Taking back a lot of learning from here. Thank you very much for entire team. Thank you.
Hello, I'm Dr. Sudhir Shetka. I'm cardiologist at Ashoka Medicover Hospital, Nashik. And I attended this program just to understand the tips and tricks regarding CTO. But at the end of the program, I could find that this is really going to help me in other intervention cases, because Dr. Reddy sir, he explained how to select the case, how to pre-plan the case and meticulously prevent any complications. In CTO, it's all about planning and going ahead. And I could learn from this program a dedicated and very systemized approach of planning a case, how to prevent the next step from getting complicating and causing problems in our case. It's a demanding procedure, takes lots of time, radiation exposure, lots of contrast burden to the patient. So it's very important to go ahead full throttle in managing and treating these cases. And this program is really very helpful in helping me out of how to plan a case of CTO. Thank you, Dr. Reddy, for giving us insight about managing these complex procedures.
I'm Dr. Pranav Vaidya. I'm a freelancing interventional cardiologist from Surat, Gujarat. This was my first time at Medicover. I thank Dr. Reddy sir, Dr. Damodar sir, and Dr. Sridhar sir. I thank them a lot. I have got a great learning to take back from here, and I urge many other young cardiologists to come over here and learn from Dr. Reddy. Learn about the approach, and it will definitely open up your mind. Thank you.
Hi, I'm Dr. Sumit Shah. I'm an interventional cardiologist from Bombay. So my takeaway message from here would be that it was a very interesting seminar. We had a good discussion on wire escalation techniques and how sir used ADR technique and how other complex materials like double lumen catheters, guide extensions are used. So with imaging, I was guided punctures of proximal cap. So it was a very healthy discussion, and that added to my perspective of treating a CTO case. The pre-angio analysis and how to strategize your CTO. So it was very helpful in that sort. So it gives me a lot of input, and I would want to think more on that. And it was really helpful for myself.
This is Dr. Ram Kumar from GKNM Hospital, Coimbatore, Tamil Nadu. This workshop is a very useful one. It is basically focuses mainly on the CTO basics to advanced techniques. And I like to thank Dr. Sharath sir's willingness to teach about CTO techniques to his younger colleagues. This will be very useful for us in our future career. Thank you, sir.